Good evening, everyone, and welcome to the STEM Academy's second Ravens Roundtable. It is my pleasure to welcome you. I am Marianne Lambert, the STEM Academy's filmatstem instructor and your host for this evening. It is my pleasure to welcome Dr. Stephen Thacker and Mrs. Mary Thacker as our guests for tonight as we discuss coronavirus prevention and healthy habits for our students and all of STEM Raven Nation. So Dr. Thacker and Mrs. Thacker, if you want to introduce yourselves quickly, and I look forward to our conversation tonight.
Sure thing. Yeah, thanks for having us. I think we're separate as many of us have had to experience through this. So Mary's at home, and I'm wrapping up at work. So I'll let Mary introduce herself first.
Hi, I'm Mary Thacker, and I have a 7th grader, Ethan, at STEM, and Steve is my husband, and so he will probably be answering most of the questions as I stay at home with the kids, and he deals with COVID all day.
And now, Dr. Thacker, you are a pediatric infectious disease specialist here in Savannah. Could you explain exactly what you are doing right now with coronavirus and then what your job actually entails?
Sure thing. Yeah. So I thankfully not everything I deal with is COVID related nowadays, but I wear a couple of hats for our hospital system. I'm the pediatric ID provider for our region. But really a large portion of my time now is in hospital leadership for the adult and children's hospital as an associate chief medical officer. But I have been part of a lot of our planning around COVID-19 and how our health systems can be prepared. Also have been engaged with schools as much as I can be, both with the school nurses and schools. We have kids, both as Mary mentioned, our son goes to Bartlett. We also have 2 children in Hess currently as well. And so I really have enjoyed the opportunity to partner with our school systems during what is a super challenging scenario of getting us back to school in person in some form. I'm also on the Georgia AAP task force for, so the American Academy of Pediatrics task force for COVID-19 as well. So I can sort of speak to what our national mental model is around COVID-19 when it comes to pediatricians and how we roll that message out to our families and obviously their kids.
So it sounds like you are in need of a well-deserved nap.
Yeah.
Like most of the country right now.
I don't know when that'll happen, but yeah.
Right. Now, Ms. Thacker, you came to attention to me when Dr. Cave excitedly shared the mask that you had made. And I think that is something that we as STEM Raven Nation are trying to figure out with how do we get our students to wear a mask? How can we bring this as a family project? And how can we engage our students in talking about coronavirus at home? So before we go into more of the medical talk, how are you having that conversation at home as you are making masks and having these conversations just as a mom?
Well, I think, Steve and I are always really open with our kids about what is happening in the world. It may be less complicated of a conversation, but from the hospital was preparing well before a lot of us were blindsided. So maybe our house was just slightly ahead of the curve, having conversations about this disease being in our country. And I think maybe like a lot of people, I'm best when I'm busy, and I felt very helpless and I wanted to do something. So that's how the masks came about. In about May, when it became clear, Steve and I were talking about how do the kids go back to school with this, that the only way a door could open was if everyone was in a mask. That was the safe way to return. So we started making masks, and we made a lot of them. You don't want to see our dining room. Steve doesn't like to go in there. But there's a lot of cut fabric, and the kids helped turning masks inside out. Ethan cut hundreds of farm yarn to help us do it. And, you know, we gave them to our friends and just gifted them and said, you know, we wear ours for you. We hope you'll wear yours for us. And that was kind of how the conversation started. And they also aren't allowed in stores, which is a big reward currently to be able to walk in a grocery store. So our 4-year-old, like, as soon as he gets in the car, says, I'll wear my mask. We also have some relatives that have been ill during this time. And so we can put that spin on it and talk about protecting them so that they can have a little more normalcy in their lives. So I guess as a parent, we were just, you know, we had a very brief conversation about what it was and germs and washing your hands. And then we just asked them very frequently if there's anything they'd like to talk about with us. Like, we try to create one-on-one space with our kids, with Steve and with me, each on their own level, and provide them an opportunity to ask us questions, because they do have questions. So that's our goal. It's not always easy, but that's our goal as a family, is to just ask them, you know, is there anything you want to talk about today?
So that's continuing conversation, open conversation. I love how you said that you don't want to see your dining room right now. We have Thanksgiving coming up, but across the country, everyone is going to have to do the clean sweep across the dining room table to find somewhere to put the turkey. Everyone's dining rooms have turned into something else other than a dining room right now.
Yes, for sure.
Yes. Dr. Thacker, we were talking about masks, and Ms. Thacker put that so eloquently, that your family says we wear our mask for others. How do masks work? How do we explain this to everyone? We hear you know, all these different definitions. Explain this in your medical terminology, but for someone like a film teacher.
Yeah. Well, you know, the mask debate really, rightfully, was kind of confusing, right? At the beginning of this pandemic, everyone was telling you, you know, don't wear a mask. It doesn't help. There were a lot of reasons behind that, around worries about enough hospital grade masks for our healthcare workers, that the CDC was putting out this message. And the message at the time was true, but they were kind of asking the wrong question about how do you just protect you from others. And the mask that we're wearing provide just a little bit of protection for me from others, but really, when everyone is wearing them, the benefit that they provide to your community is that they protect others from you. And so that's kind of a tough one to walk through, and the message has really gotten murky, and at times, honestly, a little too political, because what we do know for sure is that the masks work, and in the way that they help contain the spread of really any respiratory infection, and in this case, this coronavirus, is that it traps your droplets from your breath up on the inside of that mask, rather than you breathing them out to around you. And you know, the question is, well, why is that important? The reason for that is that many people can have no knowledge of minor symptoms, or not recognize minor symptoms, and be in the workplace, or be at school, or be with their loved ones, and potentially spread a respiratory virus such as this. And then also, there are folks that are asymptomatically infected, where they would not know that they have infection because they have no symptoms. And so, gosh, what a challenging task to try to meet for a community. And our solution at the public health level is to ask everyone, whether you have symptoms or not, to wear a mask when you can't socially distance from others. And in that way, you protect your community, and really should be looked at as a testament to that you value the other, you value the person across from you that you're talking to, you value the person that's helping you bring groceries, or you value the person that is your colleague at work or your classmate at school. And so the masks are really about protecting others from you. And if we're all doing that, then we know for sure that the rate of spread of this virus declines significantly. And in every community that they've looked where we've seen a surge and then a decline, it's been around both isolation practices, like not gathering in large numbers when you don't need to, and also enforcing masking.
So you could say that wearing masks is a great example. We say the STEM Academy of loving your people.
Exactly, exactly.
What would you say are the best practices that students and parents that all of Raven Nation needs to be following?
Yeah, I think foremost is modeling the behaviors that we would want and expect for our students when they're at school or outside of school, really. So, parents really living that message that we know works. So this, again, idea of masking when we can't socially distance from others, really good attention to detail about how we wash our hands and when we wash our hands. That you really want to always make sure you've cleaned your hands before you eat or drink and before you touch your face, or if you've touched something that you think may be unclean. And it sounds kind of silly, but the benefit of effective hand washing is one of the longest standing things that we know can prevent the spread of infection. And then I think Mary kind of led to a segue for our students. I think we're kind of pretty far into this pandemic at this point, and I hope most families have had these discussions in some way, but really talking through and normalizing what is such a different and not normal experience, right? For us in this generation, we are asking a lot of sacrifice of everyone. Including our children. And whether your schooling is hybrid or virtual or in person, there are changes to the way that we were living life before that we're asking of everyone. And that's to me, a really tough thing to walk through for many of us in the US. We've never been asked to sacrifice in this way for the betterment of others. And such an opportunity to teach really important lessons to our children about why, and you can't do that unless you start the conversation. And so, there's nice tool sets for families to do that if they're looking for strategies, whether it be from the American Academy of Pediatrics or healthychildren.org. University of Michigan's Public Health Department has a really nice video geared towards sort of that 6-year-old to 13-year-old age range to start a conversation, and they even have a free toolkit to have driving questions with your kids as strategies. If you're looking for where do I go, how do I start this conversation if you haven't had it yet. And then the other component about best practices is that I'm going to always be a big advocate that we need to have masking in the schools for kids where it's age appropriate and behavior appropriate. That we need to have a good game plan around those masks, and that you need to have at least 2 where you can have one that you wore that day, clean it, and have a fresh one for the next day. Best case scenario, if families can do it, is to have one for each day of school so that you're always rotating out a clean mask at the end of the day. And then I can't, everyone should get their flu shot. This season, like no other, is it so important that we all, if we can safely get the influenza vaccine, get it, because it will help keep you out of the hospital, and it will keep you well, and it also will help prevent very confusing situations which will come for flu season, where do you have flu or do you have COVID-19? And we have to figure out between the two so you can get back to school, get back to work, and also, most importantly, be well.
My family just went through is it flu or COVID, or is it just a virus, and got to do the quarantine. And I will testify, we believe in flu shots. We always did, but that got the message home for us. You're talking about masks, and I know some people like disposable, some like cloth. They have all different types. For children, a lot of people prefer cloth. Should those be washed daily? Is there a way that we're supposed to be washing those to make sure that they're sanitized? Because we in middle school we believe strongly in the book bag monster. Everything ends up in the book bag. The book bag monster attacks it, squishes your sandwich on it, and then that's what comes home to mom.
Right. Yeah. And so short answer is at the end of each day, that mask should be washed as a goal. And then maybe the why behind it, like, why do I need to wash this mask? I don't know that I was around anyone who has, COVID or any other infection. The inside of that is going to collect all of your breath. And if anyone smelled a mask that they've worn all day, at the end of the day, it's not a pleasant thing to put it back on the next day sometimes. But also the outside of that mask has been exposed to all the things that we're worried about, right? And so we need to make sure that we're keeping that clean, because in that process of taking off and putting on masks, what we try to avoid in healthcare systems and what we would advise for people at work and kids at school is that you never want to touch the outside of that mask, because it may be contaminated with something that could give you an infection. So with that mental model, we really should clean it at the end of our school day. And if we're using disposables, really those are meant for one day's use, and thrown away and not reused.
Now, Miss Thacker, Dr. Thacker was talking about the importance of hand washing. I am a toddler mom, and so we have been singing the hand washing song probably around 300 times a day right now. How are you enforcing hand washing at home and really getting your children to understand that we don't just wash our hands when we're out in the dirty world, but we still have to wash our hands when we're home?
Well, we've played with Alexa, which is always fun. If you have one of those in the kitchen, they have lots of fun songs. We have a 4-year-old, so we've all attended pre-K these last 3 months and heard lots of songs on YouTube in the background while we're doing our virtual school. With an infectious disease doctor as a dad, we always pushed hand washing. He's been ID since they were babies. So, we wash our hands. Steve always makes a point of it when he walks in. A lot of days we make a point of, you can't hug dad. I mean, even before COVID, like he would usually need to take off the white coat and make sure he doesn't typically wear a tie. So all of those things are things that my kids are used to a little bit. But I think making anything fun, make it a joke, do it together, make it bubbly. Anytime you can add bubbles and get them. My kids love suds. So the more extra soap, I would say, to make it a little bit more fun and keeping it light. And every time we wash our hands, if there's a lapse in judgment where they're saying, why are we doing this? Then we take that opportunity to reinforce, why do we do this? And we always talk about, well, we don't want to get sick, but we also don't want to get daddy sick. And we want daddy to go to work every day because daddy takes care of everybody. And we want to protect Mima, and we want to protect all these people. So we're always saying that as we wash our hands, the why. And they really don't fight us that much on that.
I love that. Really reinforcing the why. We have a big holiday coming up on Saturday, Halloween. What are some good tips and some things that we should avoid for this holiday? Because I know many people have had their calendars marked for probably years for Halloween on a Saturday.
Yeah, and this one hits home for us really hard. We are a Halloween household. We usually, have a big party, have many of our friends. Our community where we live in Savannah is a place where a lot of folks come to trick or treat. And so we plan for our, thousands of people coming through the neighborhood. So this one was a tough one. There's guidance from the CDC and there's guidance from the AAP, American Academy of Pediatrics, again, of just, Halloween is still coming. It is still a fun day to celebrate and have fun with your kids, but it probably needs to be different than the Halloween we had last year. And so how you craft that message with your family and your local community and your children, I think really shapes up to what expectations are had. Because, I would hope that most folks are still thinking through is probably not a good idea to have like what we would have had if it wasn't COVID-19, a large party where a lot of people are in our home with their children, eating and drinking and enjoying each other's company. That's probably not the smartest thing to do during a pandemic. And so we should limit large gatherings. Where you can have virtual parties and parades, for schools or community groups that you're a part of. A lot of folks, that's not going to be a realistic solution for them. Probably one of the most important things is to make sure that that face mask is part of your costume, whatever that's going to be. It's real clear that the message should be that our Halloween costumes that we wear really shouldn't count as that protection for your community and showing that you care about the others that you're engaging with. And then as much as you can, have any of the activities you would do for Halloween outside. The benefit of outside is that you're not in a closed box anymore. You've got a breeze, moving the air around, that really should be your strategy. And for folks that are going to have communities where there's going to be door-to-door, house-to-house trick-or-treating, the model you want to create for your yard and your community is one where we don't have big clumps of kids, which is the tradition, right? Where you got just a group of massive kids and don't know who they are. Some of them are cute, some of them are a little scary, some of them are teenagers where you're like, where's the outfit? But they got a pillowcase ready for some candy. You want to avoid clumping. So how do you do that in your yard? Some people have thought through setting up sort of stations where they're pre-prepared treats or packages or whatever you're going to give out as one strategy, so that there's spacing that's sort of forced. And then thinking about what we're offering is if we're going to give out treats. This is a great season to think about non-edible treats because we're not going to be putting these things in our mouths, hopefully, or in our hands. And if you're going to give out candy or food, thinking if there's a way to do individually or prepackaged goodies as your normal for kids to take, because you really want to, while just to set the stage, the like touching something and then giving myself COVID is probably not the most common way in which we get this infection, but we can't ignore that as a possible source. So really good hand washing in between, and I'll stop there. And, if there's any questions, it's a really tough one that, like I said, hits our family really hard this year.
And don't forget, if you do have questions while we are having this great roundtable, that you can put them in the chat as well. And after the roundtable, we will have the video uploaded to our YouTube channel, and you can always email us. After Halloween, we have Thanksgiving and Christmas right around the corner. I know new guidance has come out about celebrating the holidays. Could you expand upon that and help our STEM Raven Nation families understand that a little bit more? Gotcha.
Yeah, another real tough one, right? As many of us are experiencing, I don't think anyone who's not experiencing it, this fatigue, pandemic fatigue, COVID fatigue, whatever you want to call it, is real, and it contributes in part to some of these resurgences we've seen in certain areas of the U.S. and the world. But these holidays you mentioned, for many of us, fall in these upcoming winter months. And we know that respiratory viruses usually spread more frequently during the winter months, and it's also a time where we gather families. And so I would not say that folks should be like forbidden from spending time with their loved ones, but I think people need to be really conscious about how they are living their day to day and modeling these good practices if they're going to gather as families. So many of the very sad stories that we hear in the hospital around COVID, so many of them impact large family units because we gathered as a large group as a family, and one infection led to many and sometimes very bad outcomes. And so I don't think anyone wants that for their family or loved ones. And so how do you avoid this really difficult and challenging scenario of getting your loved ones sick from having a family gathering? You either decide that we're going to keep it small this year and have a smaller knit group, or you have these events outside where there's less forced gathering around a table, or everyone makes a commitment to each other that we're going to be very attentive. In the 2 weeks prior to Thanksgiving, we're not going out, we're not going to movie theaters or I guess there's not even active movie theaters these days, but movie theaters are not gathering in large venues. We're wearing masks really reliably. And then if we didn't do those things, maybe we bow out of the family, because no one wants to get their grandparent, their sick loved one sick as part of a celebration within a family. And so, and all the other tenets that we've spoken to about good modeling strategies to prevent the spread of this virus hold true for the holiday and winter months.
Now, Mrs. Thacker, we're talking about the holidays coming up, and in the news almost every day, we see that a different holiday tradition is changing or being canceled. Think about like the Macy's parade or something like that. How are you having those conversations at home from 4-year-olds to middle schoolers and saying, you're talking about the why. How are you explaining the holidays might look a little bit different this year?
That's hard. I think 2 days ago, my daughter said she's 9, and she said, Santa is old. Is he going to get sick if he comes into people's houses? And I was like, oh boy, no, because he's magic. So, I mean, I don't think there's ever a correct answer, and there's certainly not an easy one right now. Our children are profoundly different, all 3 of them, in their personalities, whether they're introverted or extroverted or deep thinkers. So our answer is not always correct for all 3 of our children. Like going back to school for our youngest 2 was a no-brainer. For Ethan, it was a discussion with all 3 of us. Because for the first time ever in our house, we have to consider happiness a priority, like our mental wellness. And we can't make our kids as happy as we used to, and that's a struggle. And it's been a struggle for months, and we've had to forgive ourselves in ways that we never have before. As far as fairness, like Ellie, our 9-year-old, needs people more than our 12-year-old, and I've always been like one play date for all of them. So we've had to just think on our feet and really know your children. And I don't have any easy answers for any of these questions. We're not really celebrating Halloween. We can't open our door. The way we live our lives in our house, there's no way I can open my door to thousands of people. And that is literally what it feels like. And we are all making sacrifices in preparation for the holidays, even if it's just so that I can prepare food and drop it off at Steve's parents' house, because I'm not sure in our current situation if we will see them over the holidays. She's sick. So, and we're thinking about outside, and I'm thinking about cooking 3 different Thanksgiving dinners to have delivered to these family members so we can share our food over Zoom. I don't know exactly what it looks like, but I know it's hard, and I don't think there's one answer for everybody. I think that's what friends are for. And you just have to talk it out with people that you trust, and go to sources that you believe in, and make sure that they're reputable and that you're not, we think through everything we do before we do it, a lot more so than we used to. So I don't know what Thanksgiving looks like at our house yet. We're taking a lot of things one day at a time. Right now we're focused on Halloween and trying to make that fun for them. And then we have to move on to Thanksgiving. I haven't gotten there yet. I'm sorry.
That's okay. I think one of the things that we have to remember throughout all of this, and I keep, in fact, I wrote a post-it and keep it on my desk now, is the word grace. And we all, as parents, as educators, as the grown-ups, and as the children, have to give ourselves a little bit more grace these days, and have just a little bit more, it's okay, moments every day. So I think your answer was a great answer. And it's the answer that people across STEM Raven Nation, across Savannah, and across Chatham County, and across the country are going to be saying right now, from essential workers to everyone. They're saying their holidays are going to look different, and so they're all in the same boat as you are. So thank you for sharing that. Dr. Thacker, what are we learning about? We have so much new data, and at the STEM Academy, we love our data and we love our research. What are we learning about coronavirus and how it acts? What are we seeing with short-term versus long-term effects of COVID? Is that different in adolescents versus adults? What are we seeing with new research on the horizon? What can we get excited about?
Gotcha. Yeah. So I guess I'll start with what can we get excited about? Because you're right. There's so much changing, and we will continue to learn about this virus for years to come. And I have had to live in the hospital, and just as many of us have in our workplaces, wherever they are, in this constant state of change throughout this whole process. But things to get excited about is that there is a end in sight for this first batch of vaccines. That probably won't be honestly until February, and that will be really for high risk frontline healthcare workers as the first group of individuals who get vaccinated. And then over time in the months following, we will have vaccine available to folks that are otherwise well or would be low risk if they got infected. So that is reaching a point, and we really should be amazed that we can do this in such a quick fashion when it used to take anywhere from 5 to 7 years to really test and bring a vaccine to market. What we've done is not the Operation Warp Speed has not cut any corners on safety. What they did is started producing it before they proved that it's successful. And so we've really done a lot of things in parallel. And I know that's been a conversation around the COVID vaccine and questions and worries, which are fair. But what's changed is how we've compressed it and pushed the cycle through. As far as what we've learned, you mentioned long-term effects and short-term effects. As folks have had this infection and thankfully recovered, in our hospital system, you have a very much higher rate of this not being a life-threatening scenario for you and leaving the hospital than there is death, and we're very thankful for that. That said, there are obviously bad outcomes that have happened for many members of our community that we serve. But we're learning about folks that have been given a term called long haulers, which I wish had been named or branded differently, but it is what it is.
It sounds
And
like
so,
something from Ice Road Truckers, but yes.
yeah, I would have done that differently. But the medical community came up with that terminology. So long haulers are real. First of all, there are a good percentage of individuals who get sick from COVID. So these are folks that might have pneumonia, thankfully didn't end up at home, and those folks that needed to be admitted to the hospital for their illness, that when they've recovered, they never get back to baseline. And for many of them, it is a chronic sense of fatigue, of I don't have the energy to do the things I used to do in my day. Thankfully, this does not appear to be a never-ending experience for folks, but for some folks, it can be in the order of several months now that we've learned, perhaps even longer as we live with the infection. So that's an area that we need to learn more about. Is there a reason why certain people have this experience and others don't? And also, is there something that we can do differently to help get them better and well sooner? And that's an area for research. For those of us as parents, we have learned a lot about, a couple of things. One is that, initially we felt that at the beginning of this pandemic, it wasn't clear that kids were going to be impacted. We're really hopeful that children wouldn't be impacted negatively. What we found is that when you got enough children of certain ages infected, we're finding that doesn't hold true. But thankfully, the rate at which children become sick from this virus is very low compared to adults, and it appears to be related to your age. So as you become older, you're more likely to be infected, and you're also more likely to share your infection with others. And so we see more symptomatic teenagers and young adults. We still admit children to our hospital, thankfully rarely now, that are younger than that. We're learning about that there can be a reaction that seems to be unique to children in those who have recovered from the infection, where their body becomes inflamed and leads to fevers and rashes and other symptoms. And the biggest worry is the heart not functioning the way it should, as almost an immune reaction to the infection after you've resolved it. And we call that multi-system inflammatory syndrome related to COVID-19 in children. We call it MISC because that's a lot of words to put together. And that's a scary thing for families to have to worry about. Thankfully, the rate of that is super low compared to the number of children who've been infected. And so in that, in learning about that, we're learning more and more about some unexpected consequences of the heart, especially in athletic teenagers who get coronavirus. There's something more to learn there about lasting impact, especially in athletes, on the function of their heart following this infection. And so these are all areas where we need to learn more, and we're going to still be in that state of things are changing, the guidance is changing. Return to play guidance for our parents who have student athletes as continues to change about every month, if not sooner. And so make sure you're connecting with your pediatrician, who will likely partner with a cardiologist to make sure that they're doing the best for your student athlete. And I'll stop there because I'm a scientist. I was a bench researcher in genetics before I went into medicine, so I could talk about the science of COVID-19.
Well, you have found your people.
Yeah, very good.
We can go all night for this. Yeah. You talked about things changing and that we need to learn more. And I think all of us at some point during this pandemic have gotten frustrated because we feel like the rules change. The goalpost keeps moving. Can you explain why that happens and how the data helps those rules change?
Gotcha. Yeah. Because this is, I mean, the name is novel. It's a new thing, right? This is the first time, and I'm pretty confident that at this point, this is the first time we as humans have seen this specific virus. And so a lot of what our initial thinking was based on our experiences with other viruses. And what's changed as we've gone through this process is that our initial expectations, as we talk through and teach scientific theory and hypotheses to our kids that are into science and engineering and math, that we had hypotheses at the beginning of it, and our studies have informed us in some cases to the contrary, and in some cases have reaffirmed what we thought was going on with this virus. And so we figured out that this is a different type of coronavirus, because coronavirus is a family of viruses that really cause the common cold. They've been around for likely as long as we have. And so there's things that we're learning along the way as we live through this pandemic that are informing our guidance. Prime example being mask. At the beginning, we were saying masks aren't helpful, but we were asking the wrong question. The question should have been, how do we prevent the spread of this virus using a masking policy? And then when we asked that question and tested it and looked at population data in other nations, including our own, we've proven that is an effective model to prevent it. And then also that we've learned about the consequences in other ages as more and more individuals in different walks of life, different age groups, different demographics are infected. We're learning about the nuances of how certain populations can be impacted in different ways. And so then we need to have strategies around protecting them. I'll stop there. Any follow-up questions?
No, I think, and hopefully we've given a few STEM students some science fair guidance as well along with this. I love that you said we were asking the wrong questions. And that's something that we talk about at the STEM Academy all the time, is that maybe we need to twist our question a little bit and then go from there. And it's okay to fail the first time and re-examine what's happened and use our data and research more and try again. So I think that's what the medical community is doing, and we are cheering right along with you guys. You talked about vaccinations and that we should have something around February. Can you explain? We see vaccines, we see testing, we see different types of testing. I saw that a new antibody test is coming to like Kroger's in our area soon. Can you explain the difference between antibody testing, vaccination, regular testing? We hear all of these terms. Can you simplify that for us?
Sure. Yeah. Yeah. And never have we been, I always, we talked about the sacrifices, that we're all living day to day. And I also hope that we learn something in the process as communities and health systems, as parents, as just people, but one thing I hope our healthcare communities and those that engage with them learn is now a little bit better accessibility to the concepts of testing. And so this one has really driven that home of it's really important to ask your doctor or whoever's ordering your test, explain to me what this test means, or explain to me how good is this test. At the beginning of this pandemic, we had a lot of really bad tests, tests that did not have, for us that have kids are at that point to talk about things like sensitivity and specificity of tests. That they weren't very good at saying if this test is positive, does it mean I actually have the disease? Or if this test is negative, does it mean I don't have the disease? At the beginning, our tests were very poor on both sides of that. So, how is that helpful? We've come a long way in testing since then. And so you brought up antibody tests, I'll speak to specifically. So these antibody tests really are only helpful at identifying people who've had the infection in the past. They're not super helpful at identifying if I have COVID-19 right now and it's the reason for my symptoms. Because what that test is picking up on is your own antibodies that your body makes in the hope of remembering and protecting you in the future if you get re-exposed to this virus. And that conceptually is really how our vaccines work. We mimic infection to make protective antibodies so that we don't get sick from the infection, from the virus in this case, when we see it. And so the reason I bring that up is that it's really important to make sure that if you're going to an urgent care or another healthcare provider, that you're getting the test for the right thing. So if I'm actively sick and have symptoms and I want to know if a test, or I want to know if I have an infection, in this case COVID-19, I should have what's called either an antigen test, so it's looking for the protein that the virus makes, or there are tests that are called molecular diagnostics or PCR test, and what they're doing is picking up on the genetic material of the virus. And these are usually these swabs in the nose that you can get at the Civic Center, now at CVS, many clinics, definitely in our ERs and hospitals at this point. Those are more helpful at saying, do you have disease from this infection right now? And generally, we're in a much better place. Not to plug, testing, but the Civic Center and our Department of Public Health has done a very nice job of making testing accessible. And if folks are not aware they're on the call and they need to advise someone or get testing themselves, you can get tested and have your results through our DPH within about 1.5 days, which is far better than the weeks it was before.
Definitely. Going back to vaccines for a second, mm-hmm. we hear, as parents, we're used to taking our children to the doctor. They get their vaccinations at certain times of their lives. And then we're also used to a flu vaccine that we get yearly. What should we expect with the coronavirus vaccine? Should this be something that we get once and then maybe a booster, or it should be more like the flu vaccine?
Right. We don't know. So a couple of questions in there. The first one is we don't know which vaccine candidate. So we have 4 to 6 really vaccines that made it to phase 3 clinical trials where we're testing these vaccines on people in our communities across the U.S. And so some of those require 2 dose. Well, really most of them, the ones that we will get, I believe, will be a 2-dose series. The question is, how long is the space between those 2 doses? And so for many of them, it's in the range of 20 to 30 days on getting 2 shots within 1 season. Your second question of will it be like flu? We don't fully know yet. part of the challenge of doing all this work in a compressed time frame is that we weren't able to follow people who've gotten this vaccine for 2 years, because we haven't been in this pandemic for 2 years. We don't know how long that protective antibody will truly last. And so that's a bit of an unknown. Will you need to be revaccinated in the season? There's suggestions that answer may be yes currently. But again, I wouldn't necessarily commit us to having to say it's going to be like the flu shot where you get a vaccine every year, because this will be our first coronavirus vaccine, the one that comes to market in 2021. There will continue to be people trying to make it better and more effective with fewer doses. And so we may reach another one where these questions get solved.
It may be a STEM student who invents one better one day. Hopefully they name it the STEM coronavirus vaccine, though. I'll put that plug in there. Dr. Thacker and Mrs. Thacker, how can we support the medical community and essential workers like yourself during this time? What are things that STEM Raven Nation can do? We have a lot of parents at STEM that are essential workers. How can we support our essential workers and families like yourself?
Yeah, there's and Mary, feel free to chime in. It's kind of weird we're physically separated, but to me, in a very selfless or not almost selfish at the same time, but the best way for communities to support their healthcare workers is to be well. The fear that healthcare workers have is that we all went into healthcare to serve a mission, which is to take care of others, to do it safely, to make them well, and get them back to their home and their families and their jobs and their loved ones. And so the worry around surges of patients with any problem, in this case an infectious one, is that if we have a surge of patients that aren't part of the normal, it can overwhelm a health system. And we're starting to see that in some of our Midwest states right now, where there's so many people that are sick all at once that I can't meet the needs of my community. I can't keep folks that are well with non-COVID problems. I can't take good care of them in the hospital because I don't have the space and the resources to do it. So how do we avoid getting to that point? Well, we live all of those practices that we've already spoke to and that we know work at preventing the spread of infection. But also we make sure we're taking care of ourselves as members of the community, make sure we're taking care of ourselves as parents. And what I mean by that is making sure that you're maintaining your preventative care appointments with your primary care doctor, getting those vaccines, whether it's flu or for our children, making sure that they're getting their routine vaccines so that they're protected. And we'll, because the goal is to prevent any illness that you can by being a part of that partnership with your primary care provider, so that you've done those things to do your best for that, but also not ignoring symptoms and waiting because you don't want to go to your healthcare provider, or you're worried about your healthcare provider. Right now, I think every hospital system in the U.S. and every practice has created a very safe environment to take care of their patients. Because what we have seen through this pandemic is folks that have ignored their own wellness and their health. And when they do end up in the hospital, they're ending up far sicker than they may have been if we had engaged with our primary care providers earlier, leading to poor outcomes for those patients, but also making them super sick and being in the hospital longer than they would have otherwise. And so, I'll stop there, and also get your flu shot. And I really can't say that enough.
We need to put that at the bottom of the screen.
Yeah, I do a lot of media, and I say
add to that
every time. Get your flu shot. Yeah. Mary, do you have anything to add? Yeah.
I guess just practice good decision making. Like most of us here have junior high kids, and I know that comes out of my mouth daily, like in a variety of ways to my 9 and 12-year-old. Like, let's make sure we're making good decisions. We all know there are consequences when you don't. And right now the consequences are maybe a lot more unfair and more serious than they should be. But just practice good decision making and thinking through things maybe a little bit longer than you would have normally. And if given an opportunity to do something in a safer alternative way, go out of your way for your neighbor to do that. That's what I say about school. You know, there's a lot of arguments about who's a frontline worker and who's not. But if there is a safe alternative way to do it that protects more people, try to opt for that.
Now I have to veer a little bit because I asked my 8th graders if they had any questions for tonight, and one did have a question. This student does have myself in GIS, so mapping does come into play. They were curious as to how we often hear in the news that you have a strain of coronavirus that comes from China, you have a strain of coronavirus that came out of Europe. Can you explain how this happened?
Sure. Yeah. So, yeah, not to get into the weeds of some conspiracy theories and worries about the origins of this virus, but when we talk about, for your folks that are thinking about epidemiology and the mapping of disease, really intriguing event to walk through, to learn from. For viruses, we call them clades, and so what this is genetically unique sort of footprints of a virus. And so we have about 4, and there's probably more clades of this virus. And what it does is it really helps you understand the originating source that then led to the spread in your nation. So much of our virus in the US is related to a unique form of this virus, if you will, that really began in Europe and likely entered through New York as a central hub and then spread through most of our nation. That said, we have examples of these 4 different strains or clades of the virus really throughout the U.S. now, and so now it's less of a point because there's so much still mixing. We're flying, into nations. Business and trade is still occurring. And so the longer we live through this, being able to discern between these clades and the importance of it becomes less and less of a point, but very intriguing and interesting opportunity that you don't often get in medicine or public health care, to really track something brand new and how it moved from nation to nation and changed and and then I don't think I directly answered your question as to how does it happen. All viruses mutate. They change themselves as they look for a selective advantage. Sometimes these changes make them weaker. Sometimes these changes have no effect on them. It just makes them different. And then sometimes these changes make them a little bit more more inclined to cause more disease in the things they infect. So we see that with influenza as well every year. It's unlikely, though, that the way and frequency that the flu virus changes so frequently occurs with these viruses.
I have a feeling I may have been used for a little science fair research after that answer. So thank you for such a I will pass that along and then see if I can get maybe a little thank you, Miss Lambert, for helping me with my science fair project. One final question for you. Science fair is currently going on at STEM, and every day we practice a scientific process and the design thinking process. How do you use that in your everyday job, and how are you using that right now as we're going through this pandemic?
Gotcha. Yeah, you're speaking to my soul. I had mentioned I was a geneticist before I went into medicine doing bench research, and so I was a scientist before I was a physician, and so that still held true. So how I work in those key sort of fundamental processes around scientific design, I live those largely daily. And the way that I've woven in that interest of asking questions about the world around me is really into systems and processes around healthcare delivery and the outcomes of the healthcare we deliver. But I also do a little bit of clinical research. So I help train our pediatricians and some of the other residents in thinking through scientific process and how you identify a hypothesis and do data-driven questions about the world around us, because one of the most rewarding things I think anyone can do is to grow the knowledge of others. Teachers get to experience that every day, and we do that in healthcare as well. But we can also grow our communities of knowledge in our respective fields. So, this is a prime time for folks that like to ask questions about the world around them as this pandemic has gone on. And so we're doing that really every day because we are honestly have been learning our way through this process of how to deliver healthcare safely, how to get people reliable testing. And so it's baked in and ingrained with how what we call a learning health system functions. And I like to think that that's what we do here at our hospital, that we learn from our mistakes and we set a hypothesis on how to make them better. And then we measure it with the change that we've made to prove that change had an effect. And so, to me, again, just it's part of our everyday here in the hospital.
I think someone better check Dr. Cave tomorrow. He might be writing that on the wall at the STEM Academy. So that was great. Dr. Thacker, Mrs. Thacker, thank you so much for being with us tonight. Do you have any final thoughts or advice to share with STEM Raven Nation?
Get your flu shot as a number one. Being a little facetious, but very serious. Everyone get the flu shot. No, just to me, the thing that Mary and I are people of community. Like we both like to build communities around us. I do it at work. Mary does a better job of doing it in our home than I do. But we have to remember each other. This is one of the things that I think that we have not forgotten, but it's been hard to remember that there's ways to maintain your community and support one another, because the wellness of all of us, both as parents, teachers, healthcare workers, and children, is something that is so at risk now, and we are seeing the consequence of it, that any opportunity we have to build each other up, to support one another, we really need to take it. And we don't need to ask people if they want it. We just need to do it.
So well said. Mrs. Thacker, do you have anything to add?
He's a really tough act to follow. So I'll just say I agree 100% with Steve, and we are eternally grateful for all the hard work of Savannah Chatham County Schools and every teacher and administrator and support staff. Every day we see your work and we see you, and we cannot thank you enough.
Yeah, just to piggyback on that too, I've been working with our school nurses at the system.
Yes.
Love your school nurse. Gosh, what they are having to navigate through and own to keep our kids safe and well in the school is Herculean, and so they deserve all the accolades that they can get.
Wonderful. Well, I want to thank everyone for being with us tonight. Please tell your friends and your fellow STEM Raven Nation parents and everyone that this will be available on our YouTube channel within 48 hours and also available on the STEM website and STEM social media. So thank you again for joining us. A huge thank you to Dr. and Mrs. Thacker. And as always, go Ravens. Good night, everyone.
Go Ravens. All right.